people start to realize our differences aren't as big as they seem.
I couldn't really understand the magnitude of what was going on.
I know a lot of people were affected.
You know, it's still that divide.
From the All Indiana Podcast Network and Wish TV, this is Our City, Our Voice.
You look a lot different at it.
Everybody was kind of spinning about what it was and what was happening.
Everything's changed.
The state is adding an extra $500,000 in grant funding to support Hoosiers living with sickle cell.
Supporters tell News 8's multicultural reporter Katir Winfrey that it's a vital tool to support education and attack health disparities.
In Indiana, around 87% of people living with sickle cell are Black or African American, and the health disparities we often see across the board are also there in treatment for sickle cell. I spoke to one woman living with the illness who says this will break down barriers to care. Lena Harvey is one of the many people living with sickle cell. Diagnosed at 4 years old, it's a lifelong battle.
An able-bodied, chronic illness warrior, right? Which to some people sounds like it's contradictory.
Sickle cell is a condition most often found in Black people. It's a disease marked by sickle-shaped blood cells that don't flow smoothly, causing backup in the blood flow. A common symptom, debilitating pain.
Patients are finding it very difficult to get the care that they deserve and require based on very superficial things like what a person can see just looking at them.
Harvey is part of a growing team of people, organizations, and legislators pushing for more education and resources. That work helped make the Lifelong Sickle Cell Collaborative Services grant a reality.
The health equity situation is really sad, and you're exactly right. It affects people of color disproportionately.
It's a 2-year, $500,000 grant for the state, expanding education and resources for the 1,700 people in the state living with sickle cell.
It's a very underserved population. The amount of funding streams coming in for folks affected with sickle cell disease is disproportionate to the amount of services that need to be provided.
The money will support statewide comprehensive care, allowing partnering organizations to increase specialty care, mental health assistance, and telehealth access, but raise awareness and education for the general public and those in the medical field.
You don't look sick, and those types of ideas and, thought formations, those are very dangerous.
Discover more at wishtv.com. And when you follow Wish TV on Facebook, check out more podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.